Today we will discuss how to use Epilium IPL Revive safely and correctly. We will start with pre-treatment care instructions, then explain the device usage, different treatment filters and their indication, and how to operate and set the parameters, and finally post-treatment care instructions. We start with pre-treatment care instructions. The patient must follow these instructions before coming to undergo the procedure. First, avoid sun exposure or tanning and stop chemical peels and aggressive skin treatments for the few days before the procedure. Second, the area of the treatment must be clean. Clean all the makeup and creams and apply cooling gel with the thickness of 1 to 2 mm evenly on the treatment area and thicker layer on the sensitive areas like the forehead and nose. Patient must wear protective eye shades and the operator must wear protective glasses during the treatment. Check for contraindications before the treatment. Do not perform the treatment if the patient have recent fillers or pregnancy, and be aware when working with dark skin tones. Ensure treatment head is clean, disinfected, and cool before starting. After pressing the start button, wait for 1 to 2 minutes until the treatment head reaches proper cooling temperature before starting the treatment, and ensure the filter is properly installed. Critical pre-treatment safety point is that always perform a test shot and observe the skin reaction before full treatment. This allows safe adjustment of energy and prevents complication. Now we will come for the device usage and different treatment filters and their indications. The Epilium IPL Revive uses different wavelength filters to target specific skin conditions. Each filter penetrates different depth and treats specific indication. 420 nanometer filter. This filter targets porphyrin and reduces acne bacteria. That's why it's used to treat active acne. 550 and 530 nanometer filter. This filter targets superficial melanin in the epidermis. That's why used to treat superficial pigmentations. 560 nanometer filter. This filter improves skin tone and appearance. That's why used for skin whitening, mild pigmentation, skin brightening, and skin rejuvenation. 590 nanometer filter. This wavelength targets hemoglobin in the superficial blood vessels. That's why used for vascular lesions, facial redness, telangiectasia, and rosacea. 615 nanometer filter. This works on both pigmentation and skin texture, used for pigmentation, enlarged pores, and skin rejuvenation. 640 nanometer filter stimulates collagen and improves skin quality, used for oil control and fine wrinkles. 695 nanometer filter penetrates the whole dermis to the hair follicles, so can be used for hair removal. 755 nanometer filter. This penetrates deepest and stimulates dermal collagen, used for deep skin rejuvenation, anti-aging treatment, and collagen stimulation. Now we will discuss how to operate and set the parameters. First, after turning on the UPS and the machine using the main power switch, Epilium logo comes to the screen. We will wait for a while to allow the system to initialize. Here are the parameters we must set. First, proper wavelength, which is according to the filter selection. That's according to the indication that we've talked about, and be aware that if you use multiple filters at the same session, start from the longer wavelength, then the shorter one. Second is fluence, which ranges between 5 to 25. Higher fluence equals to stronger effect. An important manual instruction is that if you see no skin reactions, then increase the fluence 1 to 2 degrees, and if strong reaction, then decrease it 1 degree. Clinical endpoint is that there must be slight redness lasting 20 to 30 seconds and mild heat sensation. The third one is the pulse width, which ranges between 5 to 100 milliseconds. General rule is that longer equals to safer and shorter equals to stronger. Subpulses, we have three options, 4, 6, and 8, which is the division of pulses to subpulses, which causes the energy to reach the skin with less side effects. 4 pulse cutting is for light skin tones and good pain tolerance. 6 pulse cutting is for intermediate skin tone and moderate tolerance. 8 pulse cutting is for darker skin tone and low pain tolerance, and also for those that have excessive pain. A general rule is that darker skin or excessive pain, then increase pulses cutting, prefer 8 and avoid 4. Temperature starts from -4 degrees Celsius to 20 degrees Celsius. In most of the treatments, we use -4 degrees Celsius. Shots count, it shows the total shots delivered in the session. Total shots is according to the indication and do not use more than 3 shots per area. Repeat, it displays the interval between light output when you keep pressing the button on the treatment head, and it's between 1 to 5 seconds. For setting all these parameters, we depend on the device user manual, then press the start and start the procedure. And of course, as we mentioned previously, we must apply cooling gel before starting the procedure. And we can quickly adjust the spot size using the magnetic gold piece when working on small areas. Be aware that during the procedure, the handpiece must be in full contact with the skin and press lightly, not too strong, and avoid excessive overlap. After finishing, remove the gel, apply repairing creams, and treatment interval is once per 2 weeks. Then clean the handpiece with alcohol, and be aware that you must work with treatment filters very smoothly and put it back to its place after finishing the procedure. Post-treatment care instructions: avoid direct sun exposure and use sunscreen. Use repairing creams for 2 to 3 days and avoid hot showers and irritating skin products like retinoids and exfoliants for the first 48 hours.